Hey there and welcome back. This is Dr. Dave. Recently in a blog I talked about the possible deleterious effects of poor sleep, to include you're going to die, sucker. But before that, it increases your risk of cancers of various sorts, increases your risk of heart disease, diabetes, obesity, Alzheimer's, and it can cause immunological dissonance, which means you'll have pockets of increased immunity and pockets of decreased immunity. In other words, you might have increased risk of getting an infection and then also increased risk of having an exuberant immune reaction, cytokine storm, so to speak, to said infection. So it's just a bad idea in the short run. It inebriates you, essentially. What I didn't tell you in that last video was, what do you do about it? Well, the best treatment across the board is probably cognitive behavioral psychotherapy, and I would encourage that if you can find someone that knows how to do it, and if you can afford it. Until that time, I might just start out with some basic behaviors. We call it collectively sleep hygiene. First, set a time to wake up every morning, the same time. I don't care what time you go to bed, what time you fall asleep. Get up every morning at the same time. That tends to reset your 24-hour clock, your circadian rhythm, as we like to call it. Next, don't do anything in bed but sex or sleep. Try not to fall asleep during sex. Your partner may not appreciate it. Okay, not speaking in this instance from personal experience, but really don't do anything else in the bed besides sleep or sex. All right, develop a relaxing, calming routine, ritual even, the hour before bedtime. Start preparing for bed 30 to 60 minutes before you actually want to fall asleep. This helps calm down that overdrive that you've been in all day. Helps maybe decrease those wakefulness promoting excitatory neurotransmitters and may allow those kind of calming sleep inducing ones to take over. All right, maintain a very dark room, no electronic gadgets, no smartphones, no tablets, no computers, no TVs, no nothing. Dark, 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 especially the older you get. Keep the temperature of the room coolish, below 7 degrees ideally. If you're a napper, limit your naps during the day to 20 to 30 minutes. Avoid vigorous exercise, excessive alcohol, and certainly caffeine in the evening hours. All right. And then if you can, for crying in a bucket, try to manage your strife, turmoil, and stress. We all have ways of doing that. But it's pretty simple. Right? I would do those things, try those things, ritualize those things, routinize, make routine those things before you necessarily call me or get formal cognitive behavioral psychotherapy, although that's certainly the gold standard. I'll be back with you at a blog or video soon as to what supplements I take. Who cares what supplements you might take to help get you sleeping, keep you sleeping in what we believe to be healthful ways. All right, until then, though, this is Dr. Dave signing off. As always, particularly during these turbulent times, it's nice to be with you. Okay, so thanks for having me. Talk to you soon. Peace out. Be safe. Stay sane. All right.